I'm Dr. Dustin Reid. I'm here with my colleagues, Dr. Bajaj, and my business partner, Dr. Ashley Gordon. And we're going to talk about an interesting article that came out this week about why board-certified cosmetic surgeons are not plastic surgeons and what that means to the patient. I think to really discuss that thoroughly, you almost have to explain why we're called plastic surgeons and the history behind that. Basically, back at the turn of the 20th century, certain surgeons became interested in complex wound healing. After World War I and then after World War II, patients were left with giant wounds that in the olden days would have meant death, but now had to be treated. And these surgeons came up with ways of moving tissues around to close these complex wounds. So when they adopted, they kind of took on their own specialty, and when they adopted it, because they move and shape things, they took their name from the Greek plastikos, which means to shape or mold, and they became plastic surgeons. Around the same time, the chemical companies invented what we all associate with plastic, and also took from the name plastikos, to shape or mold. And so then if you move forward in time to the 70s and 80s, when cosmetic surgery came into being, it just made sense that plastic surgeons, with their ability to move tissues, were the perfect people to take on cosmetic surgery. So people began to associate plastic surgery with cosmetic surgery, and somehow or another they think it's because with breast implants or something, I don't know where they get it from, since we don't really use any plastic in plastic surgery, that our patients are plastic. I don't know, but the reality is it's a very noble practice, and I know y'all are the same way. When I say I'm a plastic surgeon, it makes me so proud that that's what I do, because I know the history behind it and those who've led. Now, we all know that it's important to be board certified by the American Board of Plastic Surgery. The problem is cosmetic surgery is seen as lucrative, and where other people are struggling in medicine with lower payments, etc., the appeal is to start to try to do cosmetic surgery, and that's brought some nefarious people, if you will, into that. And I'll let one of you guys kind of speak about what is cosmetic surgery.
So the Cosmetic Surgery Board is not a board recognized by the American Board of Medical Specialties, but it grew out of a need for people who wanted to do cosmetic surgery because it's cash pay, as you mentioned, so it tends to be more lucrative. Now, as a plastic surgeon certified by the American Board of Plastic Surgery, we have to fulfill a set of requirements, which include general surgical training, plastic surgical training, written and oral board examinations, and recertification examinations on a regular basis.
Years
of training.
Years.
Now, the cosmetic surgery certification is not nearly as rigorous, and I'm going to let you talk about that.
It basically started as, basically just paying a fee. They didn't even have to take a test. And then I think now there is some sort of test that they have to take, but they don't have to meet any requirements. They definitely don't have to sit for an oral exam. They don't have to have continuing medical education. They don't have to attest that they're operating in a fully accredited operating room certified by different authorities. And so basically anyone can say they're a cosmetic surgeon, and then this board is just BS.
And so the interesting thing about this is the state of California is the first state to come out and say that you cannot say you're a board certified cosmetic surgeon because it's not a board that's recognized by the state.
Right, and I mean, great for California. Like, I can't believe it's taken this long, and I can't believe all these other states are not protecting patients. I mean, it's like, if I said I'm a neurosurgeon and I'm just going to go out and do neurosurgery, if that became like lucrative because people were going to start paying me cash to like do lobotomies on them.
The problem is, in most states, Texas being one of them, you have a license to practice medicine, and you can do with that what you want. So to use your example, if you were brave enough to do neurosurgery in your office, no one could stop you because it's under the envelope.
But who would do neurosurgery in their office?
Absolutely no one.
No one.
But they're coaxed by the dollars to do cosmetic surgery, and their background can be internal medicine, family practice, OB-GYN, it doesn't matter. Now, they do have some criteria that they have to meet. They have to have done certain cases, but they don't have to have any formal training like we do. So I think the takeaway is
they take like weekend courses, and like you can't learn things in the week on a weekend.
And it
like
has to
we
be
go
ongoing.
we go to ASAPS, and it's a week, and we were fully trained in general surgery and plastic surgery. I mean, I did 9 years of surgical training, and so I can go to a weekend course and like learn about a laser or a device.
Well, you've got the foundations, and you know how to operate over the entire body.
They're learning how to do surgery over the weekend.
And it goes back to what we spoke about earlier with filler. Sometimes these people don't even know how dangerous what they're doing is because they don't know. They don't have the surgical background. They don't know the anatomy, and that's why they can do some scary things and have real complications that they don't know how to manage. The takeaway is, see a board certified, no matter which doctor you're going to see, make sure they're board certified by a board that's a part of the American Board of Medical Subspecialties, like the American Board of Plastic Surgery.